In recent years, vitamin D has emerged as a cornerstone of health and wellness discussions. Often referred to as the sunshine vitamin, it plays an indispensable role in maintaining bone health, supporting immune function, regulating mood, and even reducing the risk of chronic diseases. Despite its widespread recognition, many individuals struggle to achieve optimal levels of this vital nutrient through diet and sunlight alone. This is where supplements come into play. However, simply taking a vitamin D pill does not guarantee maximum benefits. Understanding how to enhance the efficiency of these supplements can make all the difference in reaping their full potential. One of the most critical factors influencing the effectiveness of vitamin D supplementation lies in its absorption process. As a fat-soluble vitamin, vitamin D requires the presence of dietary fats to be properly absorbed in the digestive tract. Without adequate fat, the body may fail to utilize the supplement efficiently, leaving individuals at risk of suboptimal levels despite regular intake. To address this, pairing vitamin D with meals that contain healthy fats can significantly boost its absorption. Foods such as avocados, nuts, seeds, olive oil, and fatty fish are excellent sources of dietary fat that can facilitate the uptake of vitamin D. For those who prefer taking their supplements on an empty stomach, it might be worth reconsidering this habit to ensure better bioavailability. Another key element in maximizing the benefits of vitamin D involves its synergistic relationship with vitamin K2. These two nutrients work hand in hand to support bone health and cardiovascular wellness. While vitamin D promotes calcium absorption from the diet, vitamin K2 directs this calcium to the bones and teeth, preventing it from accumulating in soft tissues like arteries, where it could contribute to calcification. This partnership underscores the importance of ensuring adequate intake of both nutrients. Unfortunately, modern diets often lack sufficient vitamin K2, which is primarily found in fermented foods like natto and certain cheeses. To bridge this gap, individuals may consider supplements that combine vitamin D3 and K2, providing a more comprehensive approach to nutrient optimization. Choosing the right form of vitamin D is equally crucial for achieving desired outcomes. Among the available options, vitamin D3 stands out as the superior choice. Also known as cholecalciferol, vitamin D3 is the same form produced by the skin when exposed to sunlight. Research consistently demonstrates that D3 is more effective than its counterpart, vitamin D2, ergocalciferol, in raising and sustaining adequate blood levels of vitamin D. This distinction becomes particularly important for individuals relying on supplements to meet their daily requirements, as selecting the appropriate form can directly impact the efficacy of their regimen. Consistency and timing is another factor that can influence the success of vitamin D supplementation. The human body stores vitamin D in fat cells, releasing it gradually over time to maintain stable levels in the bloodstream. Taking the supplement at irregular intervals may disrupt this balance, potentially leading to fluctuations in nutrient availability. Establishing a routine, such as consuming the supplement with breakfast or lunch, can help ensure steady absorption and utilization. Moreover, adhering to a consistent schedule fosters long-term compliance, which is essential for sustaining optimal health outcomes. Magnesium, though less frequently discussed in the context of vitamin D, plays a pivotal role in its metabolism. This essential mineral is involved in the enzymatic processes that convert vitamin D into its active form, calcitriol. Without sufficient magnesium, the body may struggle to activate vitamin D, rendering supplementation less effective. Magnesium deficiency is surprisingly common, especially in populations with poor dietary habits or those consuming processed foods devoid of nutrients. Incorporating magnesium-rich foods such as leafy greens, almonds, pumpkin seeds, and whole grains into one's diet can support the activation of vitamin D. Alternatively, magnesium supplements may be considered to address any underlying deficiencies that could hinder the supplement's performance. Regular monitoring of vitamin D levels through blood tests remains a cornerstone of effective supplementation. While general guidelines recommend maintaining serum levels between 30 and 100 nanograms per milliliter, individual needs can vary based on factors such as age, lifestyle, geographic location, and existing health conditions. Periodic testing allows for personalized adjustments to dosage, ensuring that supplementation aligns with specific requirements. It also serves as a safeguard against excessive intake, which can lead to toxicity and associated complications such as nausea, vomiting, weakness, and kidney damage. By staying informed about one's vitamin D status, individuals can strike the right balance between deficiency and surplus. Beyond supplementation, moderate sun exposure continues to play a vital role in maintaining adequate vitamin D levels. The skin's natural ability to synthesize vitamin D upon exposure to ultraviolet, UV, rays cannot be overstated. Spending 10 to 30 minutes outdoors several times a week can provide a significant boost to vitamin D stores, especially during peak sunlight hours. However, striking a balance is essential. Excessive sun exposure increases the risk of skin damage and skin cancer. Protective measures such as wearing sunscreen and avoiding prolonged direct sunlight should always be prioritized. For those living in regions with limited sunlight or during winter months, reliance on supplements becomes even more critical. The interplay between vitamin D and overall health extends far beyond bone density and calcium regulation. Emerging research highlights its profound impact on immune function, mental well-being, and chronic disease prevention. Adequate levels of vitamin D have been linked to a reduced risk of autoimmune disorders, respiratory infections, and certain cancers. Furthermore, its role in modulating serotonin production underscores its significance in managing mood and combating depression. Given these wide-ranging benefits, optimizing vitamin D intake is not merely a matter of addressing deficiency but also a proactive step toward enhancing quality of life. Despite its numerous advantages, caution must be exercised to avoid oversupplementation. Excessive intake of vitamin D can lead to hypercalcemia, a condition characterized by elevated calcium levels in the blood. Symptoms range from mild discomfort, such as nausea and fatigue, to severe complications involving kidney stones and organ dysfunction. Adhering to recommended dosages and seeking professional guidance before embarking on high-dose regimens is imperative. Healthcare providers can offer tailored advice based on individual health profiles, ensuring safe and effective use of supplements. Education and awareness surrounding vitamin D supplementation remain paramount. Misconceptions abound, with some individuals assuming that taking higher doses automatically translates to better results. Others may overlook the importance of complementary nutrients like magnesium and vitamin K2, inadvertently compromising the effectiveness of their efforts. Dispelling these myths and promoting evidence-based practices can empower individuals to make informed decisions about their health. Public health campaigns, nutritional counseling, and accessible resources can collectively contribute to fostering a deeper understanding of vitamin D's multifaceted role in the body. In conclusion, unlocking the full potential of vitamin D supplements entails a holistic approach that goes beyond mere consumption. From optimizing absorption through dietary fats to leveraging the synergistic effects of vitamin K2, each step contributes to a more efficient and impactful regimen. Consistent timing, careful selection of the right form, and attention to supporting nutrients like magnesium further enhance the process. Regular monitoring ensures alignment with individual needs while guarding against potential risks. Coupled with mindful sun exposure and a commitment to balanced nutrition, these strategies pave the way for improved health outcomes and a greater sense of vitality. As knowledge about vitamin D continues to evolve, embracing these principles will undoubtedly serve as a foundation for achieving lasting wellness. As we wrap up today's discussion, remember that optimizing your vitamin D levels isn't just about taking a pill. It's about creating the right environment for your body to use it effectively. From pairing your supplement with healthy fats to ensuring you're getting enough magnesium and vitamin K2, small adjustments can make a world of difference. And don't forget the power of sunlight and regular testing to keep your levels in check. If you found these tips helpful, give this video a thumbs up and share it with someone who might benefit from it. Boosting your vitamin D doesn't have to be complicated, but it does require a little know-how. So let's take charge of our health together, one step at a time. Thanks for watching, and don't forget to subscribe for more tips to help you live your best, healthiest life. Until next time.